One of the key components of Asking Five is trauma, abuse, and safety. And each of those words means something different. Without the T in Asking Five, we're missing out a huge part of a person that could help us identify where we are having gaps, what is not being said, and where the potholes are when we're giving people care. Trauma on its own should be evaluated and asked about, but also just the overall social situation that someone is navigating in order to be their best self. So many providers have told me that they're very uncomfortable with this, and I would say I am as well. Most people are. It's very uncomfortable, especially in an obstetric space, to talk about things that are uncomfortable or may have caused us harm or pain. That is a small thing that would be able to have radical change in the life of every single person that we take care of. And there is a way to do it. We each just have to figure out how. For birthing people, trauma is whatever event happened, whether it's physical, emotional, something that they may not even really have a great memory of, that affects how they interact with other people and other situations. Abuse is much more direct. Abuse is where you are treated in a way that you shouldn't be treated, that affects the way that you view yourself, the way that you govern yourself. And then safety is, do you feel like you are in a safe situation? Are you authentically choosing what you would choose without any other sort of outside external forces? And that can also include physical, verbal, coercive, or sexual influence. But are you safe in being yourself and making decisions every day? I always lead with the reason why I'm doing what I'm doing. And then I always give them an option for not discussing it. So number one, I always start with, hey, it's really important for me to be able to take care of all of you. And some of that deals with things we might not need to discuss every day, but especially when it comes to birth experience, expectations for the pregnancy. Frequently, I want to know if there's any sort of trauma that you might have dealt with that may change the way we interact with you or the way you interact with us in healthcare. I just want you to know I understand this is difficult. It's difficult for us as well. Not trying to make you upset. Just want to make sure we're giving you full care and know how to take care of all of you. I want to make sure that you're safe, yourself and your feelings, you're safe in your emotions. So we don't need to know exactly what the trauma was or what the event was unless you want to tell me. However, it's important for me to know if you had trauma, just because frequently whenever we're talking about trauma-informed care, there are landmines around. And we don't really know that we're stepping on one unless we kind of know that it might be out there. Is that okay with you? And frequently they'll say yes. So while I might have a little bit of angst about asking that question, if I'm giving the patient or the client all the autonomy and agency, it's really about information gathering and meeting her where she is so that I can be the best provider for her and set my team up to be successful with information that I receive that they'll need to know and taking care of her if I'm not present. Don't think of it as a checkbox. Think of it as a bucket. Trust is gained in droplets and lost in buckets. And what that means, especially with pregnant people, is that at every touch point, every interaction that we have with them, we can evoke trust or encourage trust by the way that we treat them and the way that we communicate with them. So over 10 months, if we continue to build a therapeutic relationship in the way that they can authentically be themselves, we are filling that bucket.